It's really important to be thinking about workforce at the moment, given the challenges and the scale of challenges that we have. There are enormous demographic pressures, society is changing, and there are economic forces as well that mean that we really need to be thinking differently in the future about how services will be transformed and what are our workforce requirements in the future.
Well, I think the needs of the population are changing significantly, and around urgent and emergency care, frail, older people who have complex problems and need integrated, joined-up care is really the challenge that we face. The workforce traditionally has been set up more to deal with episodic care, so we really need to be making sure it's multidisciplinary based on the needs of individual patients if we're really going to meet the demands of the 21st century.
Well, I'm a commissioner of services and I commission for outcomes, but clearly I'm looking for a different type of skill set in the future to deliver those health and social care integrated services to my local population in North Kirklees. So I don't want to see silo working anymore. I want to see a shared skill set for those multidisciplinary teams. So that's why I came here today, to engage in the conversation.
It's not a case of starting from here and building from somewhere to somewhere in the future. It's more a case of examining, well, if we didn't have the past, how would we build it now? And being far more creative and open-minded in some of the issues around the types of people that we might employ within the sector, the skills that are necessary, the types of jobs that we might seek to create, career progression, how we manage talent. Those are going to be critical, because not only do we require people to be attracted to the sector to work in it, but we also need to identify how many people we actually need with what skill set. So it's very much a balance of both supply and demand of labour.
We are buffering against what have been traditional boundaries for a long time, and staff have been working in traditional ways. So part of the challenge is actually getting trust and confidence of GPs to work with staff in a wider community setting before they get to the hospital, and for hospital professionals to understand and accept that it's safe to work in the community. So there are mindset challenges that everyone's got permission to work together.
So I think we need to get into a much more organic way of working, where we're actually talking to our providers and working with our patient groups and understanding how we manage the demand in a more effective kind of way, really. It's not an easy thing to do, though, and it does require us to collaborate and work at scale in primary care as well. I think we ought to get into organisational forms that enable us to do that for a population rather than just for a group of patients in a practice.
Like lots of the contributions we've had this morning, we've done a lot of work around having sustainable, affordable roles that provide a level of consistency that some of the traditional roles and the gaps in the workforce are giving us some challenges around. So we've developed a lot of advanced practitioners, non-medical, whether they be nursing roles or physiotherapy roles or social care roles, that are providing a higher level of care than some of the lower bands in the workforce do. But unlike some of the junior and middle grade doctor roles that come for 6 months, 12 months, they provide a consistency of support, which I think benefits the system, but also clearly benefits individual patients.
Yeah, no, there's been some fantastic examples today. We've been looking at a hospital in Northumbria who have been doing this for years and really are saying this isn't new, and actually have really looked at how they engage their staff and really make it work, because they just absolutely got passion in their belly for their patients and have absolutely mobilised it. It's been fantastic.
The one key message is that if you think about it in an abstract way, it seems very difficult and the barriers are overwhelming. If you give people locally the headroom to innovate, most of those things can be cracked, but people do need the headroom, and the danger is that the hierarchical way in which we do things will get in the way of that, and we'll end up doing something that's not optimal because we haven't totally understood the grassroots issues.
In terms of our own staff, my trust has got to play its part to deliver its contract and to deliver the care that is required of us, working with all our partners. So the first thing is that our staff need to know they're in a wider team and that there are some generic skills, and they don't all need to be professional skills. There can be health trainer support, lifestyle support, the voluntary sector support. So that's part of the mindset. But other than that, it's actually working with our staff through constant change and constant savings. And the morale is not great in terms of the global economy, so it's not great anywhere. And it's actually understanding how our staff feel and supporting them through the changes.
I am struck by the increasing appetite for of people to make change happen. I think the realisation that change is absolutely a prerequisite it has landed in many places. Of course, the current arrangements mean that collaboration is necessary, and people have to be very open-minded when they're going into these collaborative, problem-solving type situations. They kind of need to leave behind personal agendas and subsector agendas and put the patient at the heart of the problem. And if we do that, then I think we can accelerate the change and also come up with some very innovative ways of dealing with the challenges that we face.